Good morning and welcome to the Contact webinar on transforming care and the work that has been done in the North East region by the Parent Carer Forums up there. My name's Sarah Thomas and I've been working as a Contact associate supporting the forums to link in with the Transforming Care team, and I'll be delivering this webinar jointly with Maureen, who will now introduce herself.
Hello, my name is Maureen Morris and I am the North Eastern Cumbria rep for the NNPCF. And we've been working very closely with Sarah and the Transforming Care Resettlement Hub up here to bring you this webinar. Thank you.
Okay, thanks Maureen. So hopefully this is all going to go to plan. This is the first time that I've delivered a webinar, so I hope it goes accordingly. Just a few little bits first of all. If there's a technical hitch, just please do bear with us. We've got Helen from Contact who's providing us technical support, ready to sort us out, so just bear with us if we need to do that. Those of you joining by PC, laptop or tabletop or smartphone should now be able to see this introduction slide, and I'm just going to move on to the next slide there for you. So we've got a number of attendees listening to this and you'll all remain muted throughout the presentation. To ask a question of either myself or Maureen, please use the question icon in the GoToWebinar toolbar on your screen, and that will allow you to type in the question in the text box and submit that to the webinar administrator. We will then go through the questions and select as many questions as we can to answer as the time allows. Hopefully we will be able to cover all questions, and if we can't answer them today, maybe do a follow-up document afterwards. If multiple questions are received on the same topic, we'll try and condense those so that we share as much information with you as possible. Okay. If further relevant questions are received and we don't have the time, we will do a question and answer document and post that on the Contact website with the recording of this webinar, details of which will be circulated next week. So, and at the end of the webinar, there will be a short questionnaire for you to just say how useful it's been, if it went to plan, and if you could take some time to complete that, we'd really appreciate it, as it helps the Contact team design future training events. Hopefully, I've covered everything that we need to now, so we'll start on the topic of today, which is transforming care and parent carer forums, particularly looking at the work we've been doing in the North East region. Okay, so what will we cover today? We're going to do a brief overview of transforming care and the work that it includes. It's quite a broad-ranging programme, and you may know, be aware of some of it, but not necessarily all of it. So we'll try and give you a good summary of where it started from, some of the things that have been achieved, some of the things that haven't gone quite so well, and where we are now. We'll look at how the work we've been doing in the North East region has been developed and how funding was brought into the region to support that through Transforming Care. We will also consider the impacts that parent carer forums can have when working with health and local authority partners in the local area, using Transforming Care as a lever to do that. And as part of the project, we'll be looking particularly at the work that we did with schools and joining up, building partnership between schools and local parent carers to support the Transforming Care cohort of young people. We want to end then with looking at the future and what's happening next. There is a continuation of Transforming Care, which will be captured in the NHS long-term plan, and we'll talk you through the key points of that plan in relation to young people with children with learning disabilities or autism, and then talk a little bit about how forums can work with partners to develop working and being involved in the delivery of NHS long-term plan. Okay. So, what is transforming care? So the key thing to remember around transforming care is that it covers those with learning disabilities and or autism. So it does relate to those individuals who may have an autism only diagnosis, which, as I'm sure you appreciate, learning disabilities and or autism is an incredibly broad spectrum, but it focuses on how those conditions in particular can mean that behaviour, that challenges might develop. The other key thing is that transforming care covers children, young people and adults. That might be a surprise to some of you, because I know that there has been quite a considerable focus on adults in some areas. It actually started back in October 2015 when a document called Building the Right Support was published, and a national service model and guidance for commissioners has been developed from this. Building the Right Support, I would recommend that you have a look at that if you get a chance, because it was a document that was led strongly by the disabled community and advocates within that community, and so there was a very significant involvement of experts by experience in producing that document. The focus, in the simplest terms, was on reducing the number of hospital admissions, or recognising or making sure that if an admission was necessary, that it was for the shortest time possible and close to home. And the phrase homes and not hospitals is one that's associated with transforming care. The actual history to this was not the most recent, but the original Panorama investigation into Winterbourne View, where it first came to light about the really appalling treatment of individuals with learning disabilities or autisms in something that was known as an assessment and treatment centre. And individuals were meant to visit these units for short periods of time, for plans to be made about how to best care and support individuals with behaviour that challenges. But what actually was happening were adults and young people were being admitted to these units and were staying there for a significant period of time. They were often a long way from home, so they were losing contact with their families, and actually the level of care that they were receiving was very, very poor, and actually, well, actually abusive in some situations. And there was quite rightly a recognition that actually individuals with learning disability and autism deserve the right to live ordinary lives in their community, close to their family, and shouldn't be institutionalised or locked away in the way that was happening. So there was a focus on developing community services so that individuals, as I say, can be supported in their own homes within their own communities. And actually recognising that although these individuals had some very complex needs, we actually, if it was done correctly and if the right support was provided, then individuals could live successfully in their own community. And as I said before, in terms of building the right support, the whole programme has, right from the start, been very much about ensuring that the voice of those with lived experience is at the heart of the programme, and that's where you get no decision about me without me. And there's some documents there, so that's a little bit of the background. If you get a chance to have a read of the documents, I've taken some time going through that because I think it's important that we understand where that's come from. So just in terms of what does Transforming Care include, as I said, it's quite a wide-ranging programme, and you may have heard of some of these elements, or they might be new to you. Again, I've included links in the presentation that you can click on at a later stage. So care, education and treatment reviews. These were originally care and treatment reviews, but as there was a recognition that we needed to move forward and include more of a focus on children and young people, and that for children and young people education plays a hugely important role, there was a new package developed called Care, Education and Treatment Reviews. These are meant to be available in all areas, and they are offered where there is a significant risk of a young person being admitted to an inpatient setting. That might not just be an inpatient hospital setting, it could also be a residential school, so where it's no longer felt that the young person can remain at home. There should be a care, education and treatment review considered, and that is a legal process that actually requires health and all practitioners to come round the table. It's formally chaired. The individuals have advocacy from experts by experience, and there should be a plan that will hopefully be able to avoid admission where possible developed. And actually, NHS England's recent statistics show that where care, education and treatment reviews have taken place, over 80% of those individuals did not go on to be admitted to inpatient settings. They also should be done every 6 months once somebody is, or more frequently if appropriate, when somebody has been admitted, to ensure that there is an ongoing focus on the person being in hospital or a residential placement for the shortest amount of time as possible, and that there's a clear plan for returning them to their community. Obviously, if we're going to support more people in the community, we do need to develop new community support services that are going to actually be able to support those people appropriately. And there's two areas of focus on that. One is looking at how we ensure there are real enhanced and intensive support delivered through the community, and there's not a reliance of having to go into an inpatient or a residential setting to access that sort of intensive support. And there's also looking at how we develop community forensic support. Now, the forensic support might be new to some of you. That's actually for those individuals who have been in contact with the law. And obviously that can add a whole layer of complexity to the process. There is a recognition that there might still need to be specialist hospitals for people with learning disabilities, and obviously that needs to be providing quality care, but specifically for people with learning disabilities and or autism, rather than just mental health in general. There's a requirement for local areas to develop a dynamic support stroke risk registers, and this is a register of the people they think may be at risk of developing challenging behaviour, or where the placement is at risk of breaking down, because obviously if we don't know that's happening, unless we know that's happening, we can't respond to it. And there's also a significant block of work on addressing health inequalities, and that's the information around the knowledge that we have around the fact that people with learning disabilities and autism may die up to 25 years sooner than their peers, are more likely to spend time in hospital, be admitted to hospital, and have poor outcomes in general. And that's mainly around the annual health checks at 14 plus onwards, the Learning Disabilities Mortality Review, which is known as LEADER, and training and workforce development, which has been in the news recently. Just to give a quick update on the current situation, some of you may have seen the most recent Panorama programme showing that unfortunately there is still elements of mistreatment and abuse happening in some places. That's created quite a focus on where we are at the moment in transforming care, and I thought these graphs really sum that up. So first of all, the figures show that the target was for between 1,300 and 1,700 individuals to be in inpatient settings by March of this year, and unfortunately we've not met that target and we're at over 2,000 still. What I would say there is that they're not the same 2,000 individuals that were there, and there have been, and we mustn't lose focus of that, some successful, very successful examples of individuals coming out of hospital settings where they've been living for, you know, 5, 10 years and being successfully and well supported in their local communities. So there have been some positive outcomes, but obviously we've definitely, you know, the government hasn't solved the issue. What we're concerned about is that there are more children being admitted, so that's under the age of 18 with learning disabilities and or autism, and that there are a significant number of patients are still over 50 kilometres from home, which we know puts them more at risk. And we still have a significant number of patients or individuals who are held for over 5 years in these inpatient settings. So that's a bit of background on where we are and what we were trying to achieve. I'm going to hand over to Maureen now to talk about what we've done in the North East and how we involved forums in this work.
Thanks, Sarah. Well, in the North East, 2 years ago now, Inclusion North were approached by the Resettlement Hub for Transforming Care in the North East to get the voice of parent carers and children and young people in their area. Fortunately, very, very fortunately for us, the chair of the CEO of Inclusion North was somebody I had worked with in Sunderland, and she very rightly said, I can't speak for parent carers, but I know somebody who can, and they got in touch with us. So that's how we became involved in it in the first place. The original expression of interest that they gave to us was quite broad. It was looking at 2 particular projects, which we'll come on to, but it was obvious that in the North East, we could not organise ourselves at that time into what it was that we wanted to do with this work, because we were a little unsure about it. So we contacted Contact, and so Sarah became involved in it that way, and that has been extremely helpful because obviously Sarah knows how Forum works, you know, is very experienced in the health aspect of it and was able to take us through it. So what we did is we prioritised the voice of parent carers and children and young people right from the very start. We went back to TCP and said, this is what we want you to think about, that participation requires an investment of time, that we need to be supported to participate, we need to show that we're valued and individuals' expertise and time is valued as well, and we need to start by being prepared to listen. So in effect, we took the reins back from them and said, we need to have a think about this first to see what we want from it. We organised a workshop throughout the region to look at actually what we wanted to do with transforming care. I think the Resettlement Hub were a little surprised by this as what we wanted to do beforehand, but they were willing to go along with it as well. And we had to then show from that that participation had made a difference. Could we go on to the next slide, please, Sarah? We linked all in with all of the areas in the northeast, or 12 areas in the northeast, and it was North Cumbria. Cumbria was covered by one forum, but the CCG, the TCP area, only covers North Cumbria, which was a little difficult. But all 12 areas in the south, in the north, were covered. So we developed a link, and we had this workshop day. We decided that we all needed to be trained on what a CETR was. We needed to have some regional reps. We needed to get ourselves organised within that, so that we invested in a team of regional reps who were specifically looking at transforming care. We started off by deciding what did SEND look like, what was a good life for our children and young people, regardless of whether or not they were part of the transforming care cohort or whether or not they were, just children with SEND, because we felt it was important as parent carer forums that we look at all children. We developed the Accelerator Project that responded to and reflected what our families told us, which was about autism in schools, and the Children and Young People's Peer Network. We've had an opportunity to have some very honest conversations with a whole group of people that we've never been able to engage with before, which was interesting. And having parent carers in the room at all of the levels, we were always seen as equals, and the Resettlement Hub really got behind this on this particular issue, because they recognised very, very quickly that we knew what we were talking about when we were talking about this. And the picture shows one of the early ones where we were still developing what it was that we wanted to do at that time. But we started off with what does good look like? What do we want to achieve for our children? And the next slide, please, Sarah.
It doesn't like this at the moment. I don't know what's going on. Sorry.
Okay.
Bear with us, everybody. This was working perfectly earlier. I don't know what difference we made. There we go. Try again.
There we are. So we focused on the Accelerator Project, and what did it involve? We had two projects. Project 1, we looked at 13 mainstream schools to improve knowledge and understand how to support autistic students and their families. We linked in with the parent carer forums in the schools so that they can create local support and information groups like mini parent carer forums with SEND, including autism. And we offered some All About Me training that had been developed by an autism specific charity in this area to some people with autism who attended schools to help them explore and understand how autism impacted on their lives, both positively and negatively. Now, it became obvious very quickly that we couldn't do it right across the region. And because of the way the Resettlement Hub was set up, and because of the people who volunteered to help with us, we ended up concentrating on the six ones that make up our South cluster, which are in the south of the region. The second project was to establish a Children and Young People's Peer Network to bring together practitioners from education, health and social care teams and parent carers to share their experience of the system and identify barriers and opportunities. This was actually for the whole of the region, and we now have a peer network of over 200 practitioners who are participants, some of whom are practitioners that you are frontline staff, and some of them are strategic leads with what it is, either GPs or whatever, which is a very eclectic group of people who come together to meet. It depends on the topic and what it is who are interesting. So those were the two projects. Now we'll attempt to move on. Next one. So what were we aiming to achieve? Well, in Project 1, we wanted to create a supportive school environment for young people with autism. You've got to remember that this was actually done before the Timson report was even started, rather than before it came out, because we recognised, and families told us when we did our workshop, that their children who were in mainstream schools were much more likely to be in exclusion rooms, were isolation rooms, were perhaps not on reduced timetables, were being sent for home to come home. So we wanted it to be a school environment. We want to improve the school environment for them, particularly in a mainstream school. We wanted to promote the person-centred approach to be working with autistic students in mainstream schools, so that the teaching staff understood what the challenges were, because very often in a mainstream school, your SENCO might know something about autism, but the rest of the school don't know anything at all. So even the staff who are working with them don't know it, or support staff don't. And actually understanding what the challenges were, and so be able to put in some reasonable adjustments in place where it was needed. And to help autistic young people to understand their own strengths and challenges, so that increased their own confidence and their self-awareness, and to improve the working relationships between families and the school by the creation of school-based support groups offering peer-to-peer support, which also help them reduce isolation. And we're speaking to the converted now. You know what it's like when your children go to secondary school. particularly if you're in a mainstream school, you no longer have the school gate of where you're taking them because they're going elsewhere. So you never get to meet any of the other parents. So you might feel as your child is the only one in a particular class who has SEND, whereas that's very often not the case. Can we move to project 2? Project 2 was to increase practitioners' understanding of how the wider system worked beyond their own work area. We found very quickly when we started the Children and Young People's Peer Networks that somebody who worked in SEND in the local authority had no idea how speech and language was commissioned, how it got into schools, whatever. Educational psychologists had no idea how things were happening in the local hospitals or in the local areas. The only ones who did understand everything were parents. So we brought everybody together, and we continue to do that, and that has been very helpful. We explore how different work areas impact or support each other, because very often people were working along the same lines and had no idea what anybody was doing, working in silos. And so that helped us identify gaps and barriers in the system. And very often we found, if looking at the triangle on the right there, very often we found that everybody was looking at the intensive support at the top of things, particularly the NHS, were looking at putting in lots and lots of money to support all these children, whereas we knew that putting in preventative support at the bottom of it means that these children don't move up into the 38 and the 52-week residential places, that they are much better supported in the community. And so we worked on actually doing low-level, cheap possibly, but low-level preventative work for the many, as opposed to having to pay and having to support these children in an environment where they shouldn't have to be there, because it's not the best place for them. And if it had been done earlier, then it may not have happened in the first place. And that helped up develop a joined up and a much better coordinated approach to providing support. And the next one, please, Sarah.
Yeah.
If it'll move. I think it's yours anyway.
Over to me now. Yeah, so thanks, Maureen. So I think one of the things just to point out for everybody in what was important about the project is that we were able, because of the Accelerator funding and because of funding associated and targeted specifically at transforming care in every region, we were able to ensure that the forums were funded to enable them to participate in this work. So we had conversations about what was, you know, how much funding there was and what would be needed to ensure that the forums were remunerated for the work that they did. So obviously the peer network, there are costs associated with that in terms of booking venues and providing refreshments, but also we looked at that project has been very much given to the forum to run that, because forums are very, one of the few organisations who has that overview, looking at all services, just the same as parent carers do as individuals. So that is very much led by the forum, and there was money given to the region to support the development of that peer network. And then for other work, not the peer network, but for other meetings, we did negotiate some payments of £100 per forum, in some cases, or £100 per representative in others, to actually attend meetings, and that came out of the Transforming Care budget and also the Accelerator Project budget. We also, when we were asking forums to work with schools, actually gave each school a budget of £1,000 to work with 2 schools, but we made it very clear in our conversations that that £1,000 did belong to the forum, and it was up to them to decide how they use that to support that work. It wasn't money that was going into the schools, and we did have to have some quite sort of direct conversations about that. This was for the forums to develop their work, and some forums, and we did ask the forums to produce a short activity plan about what they were going to do and roughly what they were going to spend that money on. And that could include promotional materials. Some forums did training, other forums did coffee mornings, and the funding just enabled that to happen. So again, just that's the funding background to the work. So a little bit, I'm going to go through the next few slides quite quickly about actually what we did, and the achievements that actually came out of that. I think, you know, we've achieved quite a significant understanding and move towards co-production in terms of the Transforming Care programme in the North East, and actually worked really closely. We were very lucky with the lead of the resettlement unit, was a lady called Julie Bates, and she had a great quote for us, which she said she thought all along that she was talking to the right people, but this project has helped her realise that she wasn't talking to the right people, because actually she needed to talk to families and to parent carers and actually hear directly from them about what the services look like for children and young people. And my apologies if you can hear the phone there, joys of working from home. Anyway, so I think we really did achieve quite significant steps forward in co-production. It was very important we understood what good would look like, because you can't aim to achieve something unless you know what it is you're aiming for. There was very much a focus on equal partnership, as Maureen's mentioned, and the steering group actually was chaired by the Director of Children's Services in Stockton, one of the local areas, and having that input from a DCS and local authority senior manager, as well as the senior health leads, actually really gave momentum to this project, so bringing them together. Forums were involved in all activity right from the start, and that was sort of a core principle. We also did some work that was informed by the voice of young people, and I'll tell you a little bit more about that later on. And we spent some time learning about each other and how we work. You know, we took time to explain to colleagues from health, from Transforming Care, how forums work, because they weren't familiar with that. So actually investing in that understanding of each other gave us a really sound base to work from, and has enabled us to build new and stronger relationships that I think will continue into the future. So Project One, which was about creating an autism positive environment in mainstream schools, that was very much on the back of, as I said, there's more children and young people going into inpatient settings, but what the facts actually tell us is they are often children and young people with autism only, not with a learning disability, and often in mainstream schools, and that they were reaching crisis points. So we wanted to see what we could do about fixing that. About addressing some of what families told us were often small problems that were left and grew into big problems. So because we were working with the local authority, we had a senior manager from early help who came across, was seconded to the project, and she was able to knock on doors of senior management at mainstream schools. And that was a really important role, having the engagement of the local authority to get the engagement of the schools. And then we worked with schools and forums to develop a learning and development timetable. And again, that was really important because when we first met with brought the schools and the forums together and we explained to schools the project, there was a little bit of a feeling of when we asked them what they needed to know, what they wanted the project to do, schools were saying fundamentally, well, we want you to tell us who to send these young people to so that they can be sorted out. And we had to really change that expectation around, no, this is about what you can do in your school to make life better for these young people and in turn make life better for yourselves. And so it wasn't about what is autism or introducing autism. What we wanted to say is, what are the challenges that you are facing on a daily basis cases, and let's explore how these might be linked to autism and therefore what we can do about it. And you'll see there the list of things that we came up with. So there was a massive focus on the issues around sensory processing and sensory issues for children and young people with autism in a mainstream school. That we wanted to do some work around supporting the young people's self-confidence and understanding of themselves, and introducing the principles around positive behaviour support. That communication came up as another key area of challenge between schools and pupils and schools and home, and how that could increase anxieties. Understanding what reasonable adjustments are and the whole issue of equality, and actually the legislation and how that applied to schools, and then working with person-centred planning and using that to engage parent carers. So the forums developed a baseline survey because we were keen, even though this was done over a short period of time, to be able to show some progress. We did a survey, and it will be available with these slides later on, and the survey was basically, how do families feel when they go into schools, and we got the families to fill that in and the school practitioners to fill that in, and compared, you know, how welcoming the school was to families, how well they communicated with families, just to get a baseline from the different perspectives. Forums were introduced to schools. A lot of schools hadn't heard of the forums before, and they worked with the schools to develop their plans to how they could create mini parent carer forums in schools. We had an inclusion and equality conference, which we got Steve Roach, who many of you will know, to come and talk about the law and inclusion and equality, particularly with regards to schools. And we had a fantastic turnout of senior management and head teachers there, and I think that was a real eye-opening moment when we discussed things like 100% attendance awards, and isolation rooms, and the legality of some of these things in terms of equality. We started the All About Me course. We also worked with young people to create materials to promote annual health checks with one of the schools. And something that worked really well is, we all know that there are issues with CAM services around the country. We block purchased, or the project did, some hours from a CAMS worker to work with schools, not on individual cases, but to develop their understanding about how things could be done differently, about why some young people behave in the way they do. And that's been really positive way of working, and actually CAMS in the region are now looking at how they can change the way they work with schools. And we also worked with one of the CCGs to produce a film about what it's like to be autistic in a mainstream school, and worked with a fantastic group of young people to produce an e-book and to inform that film. I'm going to hand over to Maureen now, just to talk about the difference it made for the region and the forums. So over to you, Maureen.
In terms of the region, I have to say it's been absolutely amazing. You know, it has been a lot of work. We have had a fair bit of money put into it as well, which has helped to be able to do that. You would have thought that there might have been a bit of a difference because the South were getting all of this extra stuff and the North weren't getting it. But because of the Children and Young People's Network, and because of the regular meetings that we have, it was very much about a shared opportunity to be able to do this. And indeed, some of the forums have been having conversations with some of the forums in the North have been having some conversations with people there about how they could roll out some quite easy things to be done. But the quote on the slide that you have in front of you is from Stockton Parent Carer Forum, who were a forum that had newly sort of regenerated themselves following some other people leaving. So we're having it quite difficulty. And as you can see, they are absolutely thrilled by how well it has gone. We found things like, when we did the survey, we wanted to be able to show what was happening with the families as opposed to what was happening with the schools, the practitioners that were doing. And somebody from one of the forums said, well, it's easy for me to do because I can do your slide, you know, pie charts and slides and things like that. So she did everybody's for them, which was really helpful. So there was a lot of sharing things that were going on. some of the schools, and in fact, one of the schools that Stockton were instrumental in working with was part of quite a large MAT, and we don't know that the MAT has now changed its behaviour policy throughout all of their schools because of a result of this working there, because of the difference that it has made within that school. In terms of working with the forums themselves, it's been hard work, and it has been difficult, particularly because of the scale of time that it was. However, it has been very, very helpful to them, and very, very helpful to the region as a whole. Thanks, Sarah.
Thanks, Maureen. This is the film that we made with Cumbria CCG, and it's called Take Time to Allow Time, and it really is worth watching when you get a few minutes. We had hoped to show you a clip, but the technology has let us down. It also comes with an e-book for people to work through as well, and all the young people who are in the film are young people on the autistic spectrum, and we went to the launch not so long ago of this up in Cumbria, and it was amazing to hear them speak about the experience and their experiences of being in school and what it meant to them to have that opportunity to share some of that, and it was very powerful to hear these young people and to talk about and to say comments like, I kept getting into trouble for being me. So if you do have some time, and please do share it widely with your local areas. Just to pick up on Project 2 in terms of the work we've done, that was very much about trying to create one system. So as Maureen said, we've got the Children and Young People's Peer Network. In the period of the Accelerator, we held 3 network sessions, but actually now the region has continued to hold these network sessions, and we hold them about once every 6 weeks, and we've got them booked for the next 12 months. We talked about annual health checks, we introduced local offer, we actually produced a report on the improving the uptake of annual health checks. As I said, we worked with the local college to produce promotional material to go out to families to promote the annual health checks at 14. And we introduced the local offer. We had a great session on the local offer. You know, a lot of health practitioners have never heard of this. So it really is about trying to get everybody on the same page. We've also done discussion sessions on the journey of children and young people. Where were the barriers? What data do we need and why? And that's helped to support the development of the dynamic support registers in the region. Just in terms of that journey, there were a couple of notable comments that came out of that. I think one of which was that everybody agreed there were too many missed opportunities. And, you know, there's lots of evidence there, and it was very powerful that small issues are not being addressed and are becoming major issues for children and young people. There's a major issue around children and young people not being able to access the support they need because of thresholds and criteria, and that's particularly around CAM services and social care, and particularly for those individuals with autism only who were not getting that early support because they kept being told you're not eligible for our service, particularly in terms of social care. Families made a very strong message about lots of assessment and meetings, but little action. And going back to the triangle Maureen shared with you previously, we need to invest at the bottom of the triangle and actually make sure people, as fewer people as possible, get to that crisis at the top. We also talked about data and about the fact we all collect loads and loads of data, and we're asked constantly as families to provide data about our children. And there was a comment that lots of people knew my daughter wasn't coping, but nobody did anything. So, you know, if we're looking at another register, a dynamic support register, it's got to really work. You know, there's got to be a consistent approach, and actually somebody then needs to interpret that data and actually lead to some action, because too often at the moment it doesn't. So what's next? The Children and Young People Peer Network is continuing, as I mentioned, and we're starting to build further relationships in the region, which has been really positive for the forums. We're hoping, we've put a bid in for all TCP partnerships have had some final funding this year. As part of that, we've put in a bid to extend the school project to the north and to embed and continue the project in the south of the region. Obviously doing a lot more sharing and promoting, such as the webinars through local and national networks. And we're thinking more and more about how what we've learned can help the implementation of the long-term plan that you may have seen in the news recently. So I don't know whether any of you have had any questions or anything to send over yet. Don't forget, you can type them in and they will be sent to us while we just come into the last few slides about the future. So we know we've got a new transformation programme, which is NHS England long-term plan. And I recently went to a conference in London for the NMPCF, which was looking at next steps in terms of this long-term plan, particularly for children and young people with learning disabilities and or autism. And they looked at elements of the long-term plan that apply to this group of children and young people. I mean, first of all, the long-term plan is saying that everybody should have the best start in life possible, and you know, I'm sure nobody would debate that. So they're looking at how we can improve services in general and experience of health services in general. But they're also looking at children and young people with learning disabilities and autism, and there's a recognition that we need to get it right for people right from the start to make sure that they have the best possible outcomes as adults. And there was a lot of feedback saying that in health in particular, there's not enough work being done for early intervention and actually making a difference early on. And also there's not enough focus on autism only. So there's a real focus on delivering that better care for children and young people with learning disabilities and or autism. There was a need for more personalised care to really look at the individuals and understand what matters to them and how health can actually deliver personalised care, and discussing how we can use personal health budgets. There's going to be an ongoing piece of work around tackling the causes of preventable deaths. So that's the leader work that we talked about earlier, and looking at how we can reduce health inequalities, so that people with learning disabilities and or autism get the same chance of having a healthy life. There's going to be an increased focus on annual health checks. Annual health checks are offered at the age of 14 plus at the moment to people with a learning disability. They're not open to people with autism only diagnosis at the moment, although that is as part of the long-term plan. There is going to be a pilot for what annual health checks for people with autism only would look like, and we're very interested to see how that develops. There's also a massive focus. Yep, certainly, Maureen.
Yeah. As part of this work, we've been working with our Transforming Care lead, and she has currently got a bid in at the moment to do autism only diagnosis annual health checks, which is without the long-term plan or anything. Just actually, it's because she has a son who has autism only. But I'll take the win where I can get it if we can get this money through. So we are hopefully ahead of the game on that one. Right, I'll mute myself again now, Sarah.
Thanks, Maureen. Joining up health services, yeah, there was a massive feedback in the work that we did, highlighting the need for services to work together and not work in silo. There's going to be an improved focus on health and well-being as well, so that whole mental health, bringing that in. Improved patient care, that's actually in your specialist support hospitals, and recognising that we do need hospitals at times, but that actually we need that improved, the care that's provided in those has to be of the best quality, and increased intensive and crisis support in the community. In terms of how forums can work with the long-term plan, first of all, the message is very clearly that participation is absolutely central to the implementation of NHS England's long-term plan, and they've developed a number of key areas that they're looking at, all of which are areas that forums could get involved in. And we'll look at a couple of them in more detail, but these are the ones that they're particularly asking for feedback on, and you will have contacts in all of your local areas that will be asked to look at these. So improving community services, the old chestnut of ASD diagnosis and post-diagnostic support pathways. How do we increase the take-up of annual health checks? How do we increase the number of people with learning disabilities on the GP registers, and increasing the awareness of the issue around health equalities, you know, about improving eyesight tests for people with learning disabilities, access to dental care and access to audiology. There were a couple at the conference, there were a couple of workshops looking at a couple of those issues, and I thought it might be useful for you to see the sorts of questions that we were asked to think about. So in terms of developing community support, you know, just that open question, ask your members, how do we support people better in the community? What would have made a difference? How do we make community environments more responsive? How do we support carers better? Because, you know, quite often it will be the family or the carers not being able to continue that might mean that a young person has to go into a residential setting. What is positive about a hospital environment? What works? What are the things that we want to promote? How do we understand the level of risk for each person and monitor that? Because we need to know how things are going in people's families, and if they're going well, that's fantastic, but if they're not, that needs to result in some action or some input. And, you know, just the old basic of what does good look like, because we really can't move forward unless we understand that. The autism diagnosis and support, there were 4 questions we were asked to consider. And that was about sharing service users' experiences, which I know all forums are good at doing that. But then thinking about what changes, what does good look like, what are the features for good, and who do we need to work with to develop and implement? Because, you know, this isn't narrowly defined to health services. We know we've got to work with schools, we've got to work with community organisations as well. So there's plenty of work there for forums to get involved in. In terms of getting involved, we thought there were some things that you could think of as a forum. We know that in the North East we were very lucky to secure funding, but there is funding coming in to all the CCGs and all the Transforming Care partnerships. And even though the partnerships, the Transforming Care partnerships might be rebranded or changed, the work on the long-term plan will still have to continue, and funding is coming to the CCGs for that. So the first thing at the moment is to, you know, make sure you know who's leading the transformation programme for your area, who's leading on transforming care at the moment, particularly children and young people. All local partnerships have to report back regularly to NHS England. They have to complete what's known as a benchmarking report about the progress around the Transforming Care programme. So looking at the number of people they have in residential care, but what are they doing to develop community services, to support people to come out, how many CETRs have they done, you know, so that you can ask to see that benchmarking report and see where they think you are, your area is. It's been really important to highlight the links between SEND and Transforming Care, and to promote early intervention, because there has been this massive focus on adults, and then when you haven't got the focus on adults, you've got the focus on the individuals who are already in crisis, who are already at risk. And we know that actually what we want to do is stop the risk happening in the first place, stop the crisis happening. It was quite interesting when we first started to work with our health colleagues in the North East. They kept talking about being good practice, being fixing something after it had gone wrong, and we had to really change that culture. And now actually good practice is about stopping things going wrong in the first place. What's the process for CETRs? Is it on your local offer? Do you know who leads it? What's happening around increasing uptake and expectations, and the experience around health checks, annual health checks? Do families know about them? What's their experience if they go and ask for one? Work with GPs to help develop their understanding of learning disability and autism, and to promote reasonable adjustments. They're not specialists, they don't know a lot of this. And who's reading on the development of the dynamic risk register in your area? What's happening and how broad is it? Is it just looking at those few young people who might be on the verge of inpatients or are in inpatients? Or is it looking to that wider group and might be struggling, who are actually on that journey and who we need to hopefully provide the support so they don't get to that point? So there's a few suggestions there, and these are all things that we've tried to do in the work in the North East. I don't know whether any questions have come in. Helen, if you have emailed me, they haven't come through, unfortunately. So actually, if they've come through to Maureen, have you had any questions?
No, not so far at the moment. I think we've overwhelmed everybody, I think. I think one of the other things as well we didn't mention is that we, in the North East, as part of using this, is we purchased for every forum in the North East and North Cumbria a number of Contact's Helpful Guide to Parents in hardback, and all of the schools that we are working with have now got a copy, so that the SENCO at least has got somewhere when somebody comes in and says, I don't know what to do, they've got something that they can actually look at, as well as having the forum's email address and flyer to be able to hand to parents. And that has been extremely helpful because it gives the SENCO something to answer parents, rather than saying, I don't know where to send this person.
Yeah, and I think sort of we couldn't underestimate the groundwork that we had to do. And I know that when we first started talking about transforming care and health, most of the forums, or most of the members of the forums, would have quite happily said that they didn't know anything about this work. And so, you know, we know that forums have had more opportunity to learn about working with local authorities and how local authorities work. And this is a new area of work for them, so nobody's expecting forums and yourselves to understand all about this right from the start. It has been about training and investing and building knowledge within the forums as well. But once we've done that, the fundamental information that you as forums bring, the ability to ask questions about what does that actually mean, has been really useful there. So those skills that you have from other areas of work have been really useful. Any tips in any area where TCPs thinks PCFs are tokenistic? And that's, so that's from Janine. It has been hard where you are, but your Health Watch should be able to help you in your area. And coincidentally, there is there is going to be a How to Work with Your Health Watch webinar as well in the coming weeks. But it has been helpful. Your send lead might be able to put you in touch with whoever it is in your area who's working on transforming care. But if you're just asking them for the data, first of all, in the first place, then they have to give you the data if you want it. You can do it on an FOI request if they're really being antsy about it, but it's better if you can build good relationships with people. And that starts to work with getting others to recognise who you are and how the local authority and the CCG are already working with you. And this is just another area of work. We will also, part of the Accelerator site, all of the projects, including the one in the North East, will be shared in a report. And so it perhaps be worth sharing that once you've found who your contact is. Say, you know, have a look at how forums worked with transforming care in the North East, how successful it was, what we brought to the table, and could we have a conversation about doing the same in our region. You know, being a parent carer forum is about just constantly knocking on doors. I recognise that, and it can be frustrating, but I think the resource in terms of the outputs from the Accelerator site will be helpful, and NHS England are pushing more and more transforming cares to ensure that they are working with their parent carer forum. Any other questions, Maureen?
Nope, nothing else.
Okay then, so I think since we're at 1 o'clock now, we're going to say thank you for joining us today. We hope that's been useful. As I say, the webinar will be available shortly for you to have a look at, with any Q&As, question and answers that come in separately. And don't forget, there is a short questionnaire we'll launch at the end of this webinar that we'd really appreciate if you take the time to complete, so we can help present, do plan our future training. So thank you very much.